Yes.
Okay, so we said it was B because now they switched where the answer was on us. All right, so again, just look at what the answer says. You want to see, does the answer make sense? Now, I suggest that if your statement or your question is longer, like this one's just one short question, so you kind of can pick your topic out right there, and it tells you what's going on there. But if it was a longer sentence, then you want to go and look at the end of the sentence and determine what is the question really asking me, because a lot of times people don't realize what the topic is of the question, and that's why they end up getting it wrong. So you want to just remember, what is the topic? What's it really asking me? Okay, which model is most useful in examining the cause of a disease in an individual based upon external factors?
D maybe?
Okay, I like
D.
D. It talks about what?
Environment.
And you know how bacteria and stuff enters the body, right? We have to have, you know, those different things. We have to have that that virus or that bacteria. You have to have a host. You have to have an entry portal. I'm sorry. All those different things that put that person at risk for contracting that disease or that illness, right? So that's what that agent host environment model is about. Now you want to know these, okay? You're going to get quizzed on these. So you should know the agent host environment, the health illness continuum. That is how you measure a person's level of health, the high level wellness model, and that helps determine what our maximum level or our maximum potential of functioning is, while we are able to maintain balance and direction within the environment. And then we have the health belief model, which talks about different health behaviors. So how we engage in health and how it affects us overall. Risk factors for illnesses are divided in 6 categories. Working with carcinogenic chemicals is an example of which type of risk factor? B.
Environmental.
Okay, good. Environmental. Okay, so you see, this one is a really long sentence. All right, so in order to answer these, what you want to do is you want to read the statement first at the end. All right, which statement best describes the difference between the concept of wellness and the concept of health? So that's really what your topic is asking you about. And if you're not sure, you can even go down and look at some of the answers down below, and that will kind of guide you a little bit more about what the topic of the question is. All right, so now let's read the whole question. A nurse has chosen to characterize a new initiative as wellness promotion rather than health promotion. Which statement best describes the difference between the concept of wellness and the concept of health? Wellness is dependent on the resolution of acute and chronic illness, whereas health can exist at any stage or condition. Wellness is an active state, whereas health is more passive state dependent on the absence of the disease. Wellness is determined by age-related expectations, whereas health is an achievable state at any point in the lifespan. And health is a state that can be promoted and protected by nursing practice, whereas wellness is solely dependent on the client. What do you think?
I think either
B.
A or D.
And B should be correct.
B.
Dog? Or B as in boy?
Passive state.
Yeah, like wellness is an active state.
B.
I think it's,
An
I don't know.
active
I
state?
still feel like it's A. I don't know. Maybe I'm wrong, but
Okay, well, better to be wrong now, right?
right.
I always say be wrong now, not on the exam. All right, so yes, wellness is an active state, whereas health is a more passive state, depending on the absence or the infirmity of the disease, right? Good health is a passive state. The person is not ill. Wellness is more active regardless of the level of health. Wellness is not contingent on the resolution of disease or illness, and it supersedes age. Both health and wellness can be influenced by the nurse. Okay, so the question says, this is an example of which of Dunn's processes that a person know who and what he, that helps a person know who and what he is. So now let's read the whole statement. A client makes a decision to quit smoking and joins a smoking cessation class. This is an example of which of Dunn's processes. So in order to answer this question, you got to know about Dunn's processes. And again, this is something that I would want to know, that I might focus in on, you know, and learn, because they might ask me about this, right? So what do you think? Dunn's, who knows Dunn's?
Becoming?
I would just guess with A, befitting.
Befitting,
Yeah.
okay, and I hear becoming. How about everybody else? What's everybody else think?
I think becoming too. It's befitting.
It's befitting. You sounded confident.
I think it's befitting.
Yes. Befitting.
I am, it's
Hey.
befitting.
Okay, good. So define, Dunn defined processes that help a person know who and what he is. These processes are part of each individual's perception of their own wellness state and being, recognizing themselves as a separate and individual person. Belonging is being part of a whole. Becoming is the ability to grow and develop, and befitting is making personal choices to be fit to self for the future. So, you know, they're helping themselves or benefiting themselves for the future. So quitting smoking would definitely be a befitting choice, right? So when you think about befitting, think about I befitting myself, right? I'm fitting myself. I'm broken, I gotta fit myself. So I'll be fitting myself when I'm smoking, right? By stop smoking. Because if I stop smoking now, it could do me a lot of good later. We did this one. Let's see how many remember what it was.
E.
B.
Acute illness.
Oh. All right, so acute illness, it's going to have that rapid onset, last for a short period of time. Now, acute illness versus chronic illness. What are some things that we'll see with the patient who has an acute issue versus chronic?
Rapid onset.
Fever. It's just rapid. It's fast. It comes on fast. Something like I don't know, pneumonia, flu, vice versa, something like rheumatoid arthritis, which is gradual.
Change in anatomy and physiological structure of the person.
And we look at them differently. So like if my COPD patient has a pulse ox of 90, am I worried?
No.
Not really. But what if it's a brand new patient I've never seen before, not diagnosed with COPD? They just suddenly became short of breath and their pulse ox is 90. Am I worried?
Yes, you have to be worried.
Yes, you have to be worried. And what else am I going to see with that? Probably some sort of change in mental status and some other things going on. And I'm going to have to give this patient oxygen to bring their O2 sats up. But if someone has chronic COP and their pulse ox is 90%, their cognitive abilities are probably going to be okay because their body's already adapted to that chronic hypoxia. And you can't give them high doses of oxygen because the body's adapted. So if you give them a high dose of oxygen, it's going to shut off the mechanism in their brain and cause them to actually stop breathing because the body doesn't realize, you know, what's going on there. It's adapted to this other lifestyle now. Or compensated is what it really does. It compensates. Which of the following is an example of the characteristic of stage 2 illness? So stage 2, stage 3, stage 4 illnesses, we're talking about Suchman's, right? You guys remember Suchman's? We were talking about him the other day.
B.
No.
So stage 2 is when we what?
When you go to the doctor.
We acknowledge that we're sick. We acknowledge
acknowledge
that
you're
we're
sick.
sick, and we allow people to help us, right? We're not in a dependent role there yet. Okay, so here you go. In stage 1,
It's when you have the symptoms.
you're going to define yourself as being sick, and you need validation. Okay, so you're going to give up normal activities. Sometimes, in stage 1, you're going to start to have symptoms. Sorry, I read the wrong page. Let me not read the page. Let me just tell you how it is. That'll be better. In stage 1, you're going to have those symptoms like pain. That's the most common one, right? And then, you know, headache, sore throat, things like that. That's stage 1, okay? Pain is the most common symptom in that stage. And then in stage 2, now you're acknowledging that you're sick. So maybe you're a nurse and you call out and you tell the job, hey, I'm sick. I got the flu. I'm not coming in today. In stage 3, you realize that you're sick and you need to go get some sort of plan of care. So you actually do go in stage 3. You go in, you see a physician, and you start to receive treatment. Okay, so D is going to be stage 3 there. And C is stage 4 because now you have a chronic illness and you've already went to see the doc. You already got a treatment plan. He treated those short-term problems, right? Now you're going to go through therapy and rehab to address the long-term consequences of that problem. All right, so 2 should be B. Okay, you're assuming the sick role. Which is an example of the socio-cultural dimension influencing a person's health illness status. Socio-culture.
D.
Okay, D. Anybody else? Y'all can all chime in now. Okay, socioculture refers to health practices and beliefs that are influenced by the person's economic level, lifestyle, family, and culture. In general, low-income groups are less likely to seek medical care to prevent illness. Why? What's the number one reason?
maybe getting to the doctor, or there's no place in the area for them to go?
That's not the number one reason though. What's the number one reason why people call 911 for a toothache?
They don't have health insurance?
Yes, ma'am. All day. They don't have health
They don't have
insurance.
Health insurance, right?
Okay. Now, what you're also saying is true. They may not have transportation to get there. And people tend to stereotype you if you're coming from a low income neighborhood, right? They're going to stereotype you. So if I'm, well, for one, let's talk about obesity. Now, people tend to stereotype everybody that's obese. It doesn't matter what neighborhood you come from. So if I'm obese and I walk into the doctor's office, right? What is the first thing that they think about me?
Здравствуйте, Сергей. Скажите, пожалуйста,
Fat, lazy, Yes, you're unemployed, lazy.
Lazy, over,
You don't have a
sometimes they
job.
associate hygiene with overweight people. They eat too much. Those kind of things, right? So if I'm from a low income neighborhood, what are some things that they might stereotype about me, and what kind of risk factors do I have? Well, the government tries to address this. They tried to do this with the Michelle Obama program, if you guys are familiar with that, with the obesity on the kids. And, you know, they tried to do it by bringing things like fruits and vegetables and stuff like that into the neighborhood, because how many low income neighborhoods do you go into that you see like a produce junction and a clinic on every corner? How many? Are there
Not many.
produce
Barely.
junctions in the
Many at
low
all.
income
Not many.
neighborhoods? Do you ever see a
Not at
produce
all.
junction in a low income neighborhood?
No.
It's not there, right?
No.
What's on the corner of every corner there?
A liquor store or like
A
a
poppy store.
mhm.
Exactly. And in the poppy store, what do they cater to? You see it sitting up on the counter all day.
Junk and cigarettes
Food.
and
And drug addicts, right? They have everything they need if they want to smoke crack. They have everything they need if they want to eat junk, but nothing healthy. The healthy stuff they do have in there, you have to pay an extraordinary cost to get it. The bus or something, because sometimes in those neighborhoods, they have like a little bus, right? That comes around the neighborhood in the summertime and sells stuff off the truck, right? And what kind of stuff are they usually selling off of that truck?
junk.
Junk, cigarettes, stuff like that. So, you know, if you go to a different neighborhood, a more upscale neighborhood, you're going to see 2 or 3 different doctor's offices in that neighborhood. You're not going to see too many in the way of liquor stores. And you'll see a lot of grocery stores, a lot of fresh produce places. So what Michelle Obama did was try to bring that to the people in the community. Here's the problem with that. Like where they were sitting up at, they would bring the produce stands into the community, but like where I live at, they brought it to the police station. Now, if I live in the lower income neighborhood, in order to get to that police station, I got to ride a bus because it's a little bit too far to walk, especially if I got to carry groceries back. So, you know, how many of these people are going to get on the bus and ride there to get the produce at the police station, which is where everybody wants to be? Right. And then on top of that, when they brought these groups in to sell the produce, instead of selling it at the same price you would get it at Produce Junction or the grocery store, because they relocated their business here to help these people, they jacked up the prices on the produce. So most of the people that are coming in here are paying for the produce with either a SNAP card or a food stamp card. So, you know, again, how fair is that they allow them to come in and actually jack those prices up? There should be something written in the contract that when they come into the neighborhood to sell, they have to sell the produce at the same price that they would have to sell it in the store. I mean, the government likes to throw money away. Why couldn't they support that program? Because honestly, these people that are in these low income neighborhoods, they're there because the government really sticks them there. And I know that a lot of them get stereotyped, oh, they don't work, they don't try to better themselves, but the way the government has it set up, if you're only giving me $500 a month to live on and $500 in food stamps, realistically, how many of you can live on that?
You can't.
No, you can't. Okay, you can't live on $500 a month because, first of all, even if you don't have cable or a phone bill or whatever, you can't even find a place to rent for that in New Jersey. Not everybody has subsidized housing. So, you know, if you're realistically thinking, you make these people do illegal things to try to live. You make them violate the tax laws to try to live. Now, if I'm a single mom and I work, and let's say I make $20,000 a year, how many of y'all can live on that? With a couple of kids? It comes
Not
out
me.
to what? A little bit over $1,000 a month. So you probably would bring home about $1,000 a month once they take out taxes. Maybe $1,500. So, you know, grocery store, you know, car insurance, riding back and forth to work. The kids need school clothes. They need lunches. Now, the government won't help me because I'm working and I make too much money, right? They'd rather me be not working and not doing anything. So they don't really support this dynamic. But the whole thing is to try to bring equality into healthcare by giving these people an opportunity. One, you're starting to see this now with some of the doctors where now they are starting to open up clinics in some of these neighborhoods, and they're trying to give back to the communities that they grew up in or that they came from. And, you know, hospitals and stuff should give people incentives, because if we could go into these neighborhoods and teach people how to live healthier and offer them healthcare and do wellness clinics as opposed to only seeing them when they're sick, we could probably prevent a lot of things that are going on in these neighborhoods that actually end up costing the healthcare system enormous amounts of money. But the government makes money off of it, so that's why they're not interested in fixing the problem. Politicians, you know, that they're all about making money. All right, the nurse is caring for a female client age 17 whose left leg was amputated after being crushed in a motor vehicle accident. Which of the following interventions might the nurse perform to accommodate the client's intellectual dimension? So 17 years old, what is that developmental level? And that's what it's asking you. Okay,
It's
do you know
D.
what the developmental level is that would meet this child's needs?
Is
D.
it D?
I said B.
D.
Okay, teaching her how to care for the stump and explaining the rehab program, encouraging friends and relatives to visit often and bring great games to distract her. All right, so how many think it's B?
I do.
I would say
Yes.
more providing, if you think about Maslow's hierarchy of needs, I would think would be more about self-esteem. I don't
Right.
know.
So
I think it's D.
I get a D.
About C.
I got B.
Well, you're definitely gonna do C, no matter what.
Right.
But it's asking about the intellectual dimension.
Right.
So intellectual,
So A, right?
B is actually more social to me,
A.
because when we're doing games, distraction and stuff like that, that's kind of more of a social thing or a belonging sort of thing. A, have a counselor come in and talk to her about her loss. I feel like that's more affect and emotional.
Okay.
So a lot of people pick D. Let's see what D says. So the intellectual dimension encompasses the cognitive abilities, the educational background, and past experiences. These influence the response to teaching about health and reactions to the nursing care during the illness. They also play a major role in how that patient's going to behave towards their health. Remember that the patient has to have some sort of value connected to the health. Developmentally, they have to be able to understand the directions that you give them. Cognitive is understanding the knowledge base. Okay, remember in Technological is going to be that stump being actually able to care for the stump, not just knowing how, but actually doing the physical care. So it would be the actual wrapping or unwrapping of that stump, and you know, whatever other treatment that it would need. Okay. An exacerbation refers to reactivation of a disease. Which condition is associated with exacerbation?
A.
Chronic.
Chronic illness. Okay, good. You guys don't really need the rationale for that, or you shouldn't. All right, a client arrives at the healthcare facility complaining of pain in the abdomen and diarrhea. The physician diagnoses the client with colitis, an acute illness. Why is colitis considered an acute illness? So here's your choices. It lasts for a long time. True or false? Is that a criteria of being an acute illness, lasting for a long time?
False.
Okay.
No.
It's not curable. Is that a criteria of being an acute illness?
No.
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 Is an acute illness generally difficult to treat?
No.
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 Is an acute illness have a sudden onset?
Yes.
Yes.
So you see how you can kind of go, and this was a little bit of you know, a simple question, but you use the same strategies for all questions. Because a lot of times what you'll do is you'll just go through and look for the right answer, but you need to understand why it's the right answer and what's the outcome going to be if you pick that answer. Because as you start to progress into harder questions, you're going to have a hard time sometimes making a choice between two. You'll be able to knock two out, but the other two, you're going to have a hard choice. So you're going to start to look for patterns. Some patterns that will help you make that decision if you don't know the answer to the question is one of these things is not like the other, one of these things is different, you know. But sometimes something will stand out, it'll be totally different than all the other answers in the question. Sometimes you'll have two opposites there. So one answer will say one thing and another answer will say something completely opposite. You want to think about what the outcome's going to be. Is one of the answer choices an assessment or an intervention? Are the answers psychosocial or are they physical? Is the patient's problem real or are they just at risk for it? Is it a potential problem or an actual problem? So you're going to address actual problems over potential problems always. And a lot of times when they're asking you, you have the greatest risk, usually one of those answer choices is going to have 2 or 3 risk factors. And that's what makes them a greater risk. When you do select all that apply, okay, select all that apply are knowledge content questions. So when it asks you the question, you have to read the answer choice as if it's a true or false statement. And that's the way you read each statement in the answer choices. Each one is a separate statement from the other. So you really want to take your time and go through each one of those individually for the select all that apply. A community health nurse arranges for a dental checkup camp for local children in the school. Which of the following would most likely be the nurse's goal for the health camp?
Health promotion.
B.
B, illness prevention.
B.
D, health promotion. All right, I like the health promotion one. Okay, educational and lifestyle choices is part of health promotion activity, which focuses on protecting the person's health. The goal of prevention of illness is to detect and prevent the illness. High-level wellness focuses on maximizing the person's highest potential for functioning, and reversal of self-care deficits would involve therapeutic interventions that are directed at contributing factors. While providing client care, a nurse determines that a client adheres to the health belief model. What would the nurse need to assess as a factor possibly affecting the client's response to illness?
A.
Environmental sensitivity, stress management, nutritional awareness, personality characteristics. So how many think it's A? Anybody?
Not sure.
I'm thinking stress because stress has a lot to do, but it is talking about the health belief model.
I'm torn between A and B.
Care to a nurse determines the client adheres to the health belief model. What would the nurse need to assess as a factor possibly affecting the client's response to illness? Environmental, stress, nutritional, or personal?
I'm
So
gonna
Could
say
be
the health
stress
belief
because
model
health
is
I
belief
could say
concerned
it
with
could.
how people perceive or what people perceive to be true about themselves in relation to their health.
I'm gonna go with
Many
D.
factors for
So
could be
health
stress.
include
I'm gonna go D.
demographics, socio-psychological, and structural variables, and it's based on 3 components of the person's perception: your susceptibility to the disease, the seriousness perceived of the disease, and the benefits of action. So what do you guys are saying? Which one? D?
D. I said D.
B as in boy or D as in dog?
D is in dog.
D.
D, yeah.
Personality characteristics.
Of course,
I'm
the
kind
health
of stuck
belief
between.
model. I'm still torn between A and B, but I'm leaning more
Me, I'm
towards
I'm
B.
torn between A and B. I don't know about D, but
Yeah,
A,
I like A and B, but I like B more. B more
yeah.
seems to adhere more to the situation. Because
I
stress is
think it's
definitely
A.
a factor for illness. You can be stressed. I like B. B. Well, I'm gonna go B.
Stress can definitely affect your how you
Health.
perceive pain. So
Yes. For sure.
I mean, whatever we pick, right? We'll be wrong now. We'll know the correct answer. So
D.
Okay, it
Sidious
was
was
D.
right.
It
Go
was
ahead,
D.
Sidious.
Go ahead, Chris.
Right.
Now, why was he right?
Chris, you cheated.
Why was he right?
Right.
He was right because I just read to you that the health belief model is based on 3 components: the person's perception of the threat of disease, the susceptibility to the disease, the seriousness of the disease, and the benefits of action. So that's why it was a personality characteristic. So it's how that person sees themselves, because some people with cancer, right? They just be like, okay, so what? I got cancer. I'll go get chemo. I'll get it. And other ones be like, oh my God, I'm dying. I can't take this. And, so everybody responds differently based on their experiences, how they perceive themselves in their own state of health, and what they know about that health, and how they respond to that treatment or that illness. So good. Hopefully we remember that one for the exam, okay? Because you might see similar questions to this. They probably won't be the same exact questions, obviously, but you may ask about these health belief models, okay? And you want to know the health promotion model, the health illness continuum, the host environment model. You want to know how all these work.
Come on, King, I'm in class.
Sorry, Mom.
Well, I'm going to go to another chapter now for a little bit. I thought this was going to take us to different questions when I picked 50, but it doesn't. It looks like it's staying on health and wellness. So I might have picked 50 for each chapter.
Come on, girl.
Okay, so now we're going to chapter 4. So the nurse assists a post-op client with ambulation. Nurse recognizes that assisting the client when performing this skill, which meets which of Maslow's basic human needs.
We don't see anything.
The screen still says chapter 3.
I didn't even notice it says chapter 3. I'm like, what's she reading?
How about now?
Yes, we can see it now.
Chapter 4?
Yes.
Okay, good.
B.
B, for sure, B.
B.
Okay, B, safety and security.
Yep.
Okay, good. We carry out a variety of activities to meet the patient's physical safety needs. We help move and ambulate them, okay? And we assist them so that way we know that they don't fall. Okay? We don't want them to fall. We don't ever want them to fall.
You fucking kidding me?
Parents are raising 2 school-age children and they incorporate their religious beliefs into the family's daily life. The family's beliefs regarding religion include dietary considerations, worship practices, attitudes, and values. This is an example of which function of the family?
C.
Think C.
Socialization.
Yeah.
Yes.
Yeah, I think.
Okay, through socialization, the family teaches, transmits beliefs, values, attitudes, and coping mechanisms, provides feedback, and guides problem solving. Incorporating religious beliefs, values, and attitudes is an example of socialization. Physical functions of the family include providing a safe, comfortable environment, necessary growth and development, rest and recuperation. The reproductive function of the family is raising children. The effective coping function of the family includes providing emotional comfort to the family members. All right, you guys read this one real quick. I got to just run to the bathroom real quick. All right, what do we got?
B.
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 An adolescent confides in the school nurse that she argues daily with her mother and she often wonders if her mother loves her. The school nurse recognizes that the student faces which of the following risk factors for altered family health? So we said B as in boy.
Yes.
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 Okay, good. Conflicts between family members are considered psychosocial. In caring for a patient, the nurse recognizes which of the following as primary educational support structure for an individual.
C.
Everybody agree with Gideus?
The C. Yeah.
B. Yes.
B.
Okay. B, you think family members provide the primary support
C.
for
Teacher.
education?
Yeah.
C.
It's B.
Ooh.
So good
Yay.
job for those of you that picked B. All right, so family is a primary educational and support structure for an individual. The family as a social unit provides the environment and relationships necessary for members to meet basic needs. Peers become strong during adolescence. Teachers and coaches impact school age and older children. Clergy are impactful for those that attend church. A nurse working with patients in a community is aware that which of the following is a true statement related to environmental factors in that community. So lack of health insurance is a negative environmental factor affecting one's health, access to healthcare. Environmental factors focus on the harmful effects on an individual's health. Barriers to accessing healthcare within a community may include lack of transportation. The quality of air and water are relatively consistent when comparing urban and rural environments.
On with C.
C.
Everybody agree with that? C?
Yes.
All right, barriers to accessing healthcare within a community may include lack of transportation. Environmental barriers include lack of transportation, distance to the service, and the location of the service. Lack of healthcare insurance is an economic barrier. Quality of air and water differ across communities. We knew that, right? Because it's not the same in the country. You know that if you go to LA or if you go in the country, air is totally different, right? Or the quality of the air and water is totally different. Environmental factors not only focus on harmful effects on health, but also beneficial effects on health. All right, let's read this statement first because this is one of those long questions. So, which of the following factors is the primary influence on this aspect of the family's health? Parents have a blended family. The parents of a blended family have a baby boy age 6 months who is due for immunization. The clinic closest to their home is recently closed, and they feel intimidated by the prospect of going to the large university hospital near their home. Which of the following factors is the primary influence on this aspect of the family's health?
C.
Everybody agree with her?
B.
Okay, community healthcare structure, the size, the location, and the services of healthcare offerings in a geographical area are components of the community healthcare structure and its influence on health. Family functioning, lifestyle, and economic considerations are not primary influences on the family's action. The nurse is planning education on self-administration of insulin to the client and his family members. The client asks the nurse why the family members are also included in teaching. What should be the nurse's response?
B.
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 Okay, why B?
Because the family members get involved too. Sometimes you need their help to help push the other person to do right.
Okay. Also, if I'm in the hospital and somebody's teaching me, all right, what is my mind on?
Leaving.
At home.
Exactly. Like, what am I in the bed doing? I'm like sweating the fact that they told me 4 hours ago that I was being discharged and they still haven't come in here with a wheelchair.
Mhm.
So, you know, sometimes it's not the optimal time to teach somebody. This helps also if they go home. You know, did you ever, like, your mom or dad went to the emergency room and they're older and you weren't able to go with them, or even your grandparents, and you weren't able to go with them because of one reason or another, but when they came home from the hospital or whatever, and, you know, even if you were at their house or on the phone, either way, let's say you were at their house and you were asking them like, hey, what did the doctor say and all that about, you know, what's going on? What do they normally tell you?
What you want to hear.
Or, oh, I
Oh,
don't
no.
remember, you know, I don't remember. They just blah, 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 you know. And then when you even ask them for the paperwork, sometimes they can't even give you that. Like, get it all messed up. So a lot of times maybe they don't give you the paperwork because they don't want you to see what they don't want you to hear also. A nurse is caring for a client diagnosed with pancreatitis. Oh, let me just go back to that other question for a minute. I just want to say one more thing on that. What else might affect that component of having the family involved? Might be the culture or the ethnicity or whatever. Because let's say I'm teaching the client how to do something to care for themselves, but the families of some ethnic group or culture that doesn't believe or doesn't buy into that treatment. Now I've taught this client to do that, and they go home and the family's like, oh no, that's not how you're doing that. This is how we do that here. So it might give you a little insight also onto how to guide that patient based on their cultural or ethnic background. All right, the nurse is caring for a client diagnosed with pancreatitis. Which of the following is a priority need for nursing management? So again, remember we
A.
talked about these questions, and what I said
A.
was, is it physical or is it psychosocial? So one of these things is not like the other. One of these things is different, you know. First one is a physical symptom, and it's a real symptom, an actual symptom, right? It's not a potential because the patient actually has pain. Second one, lack of self-confidence. Is that physical or psychosocial?
Psychosocial.
Depression, physical or psychosocial?
Psychosocial.
And inability to take care of the family. Well, it might have a physical component to it, but ultimately we're talking about the role that you play in the family dynamic. So maybe I'm the husband and I had a massive heart attack and I can't work. Now I'm not able to take care of my family. How's that going to affect me? Is that going to affect me physically or psychosocially?
Psychosocial.
Social.
Right, because I'm not going to feel like I'm not a man, right? I can't be a man if I can't do what I'm supposed to do for my family.
This is it.
All right, so acute pain is a physiological need. Pain definitely falls under Maslow's hierarchy of basic human needs. Okay, we're gonna fulfill physiological needs over psychological or psychosocial issues. The nurse performs an assessment of the client and the family to have a better understanding of the client and the family needs. Which of the following is an individual need?
A.
Yeah, one of these things is not like the other. One of these things is different, you know. Right? Which one's different?
B. B, political.
Political.
I feel like A is different
Yeah, A is
Yes,
Yeah,
different.
it's
A.
different.
A.
Thought I was crazy.
because A is more about physical.
Right.
B is not about physical. That's about socialization. Really, politics. That's really what it's about. That and lies. Socialization, really, and politics, you know, that politics could be a part of your socialization. And then education, okay? So that's why I say A is different, if you understand. Also, right, A is part of Maslow's hierarchy, and the other answer choices are things that are provided by the family. Right, your parents tell you basically who you're going to be politically connected to. They tell you who your friends are going to be, and if your parents have a certain level of education, you're more likely to follow along that line because they role model for you. You might go above and beyond what they did, but you're going to probably do at least at minimum what they did at some point in your life. Which of the following theorists supports developmental framework of family assessment? Duval, is that what you said?
Think.
That's
D.
what I
I
too.
think so too.
Think it's D.
I think it's B.
Okay, Duval. Duval will not let your family fall.
Exactly.
The community environment affects the well-being of the individual and the family. Which of the following is the health responsibility of the family?
Community environment of
A.
A.
Okay. Again, I feel like A is not like the
A.
others. It's talking about a healthy lifestyle choice. Everything else is talking about healthcare for services, educational services, recreational services.
Mm.
And you make a healthy choice about that, right? Because if you notice in families that start their children out with eating things like fruits and vegetables, if you introduce those things to children when they're young, they'll eat it. When you give kids other stuff like crap, that's what they want as they grow up is more crap. They don't want to eat a healthy lifestyle because they're used to eating crap. That's what they see. And so it's hard to switch them over from eating crap to a healthy lifestyle. But if you start them on a healthy lifestyle of eating, it's easy to keep them on that lifestyle. A young couple who have been married less than a year are having difficulty with adjusting to parenting. What is a contributing factor to this level of maladjustment?
I'll say D.
A.
A.
Vote A.
A.
I like A, and I'm tell you why. Because, you know, when you're dating someone, it's totally different from being married to them, right? Because you don't see those little idiosyncrasies that they have once they leave that perfect date world. Because when I'm dating you, what am I trying to do?
Press.
Ignore
Impress
it.
you, right? Once we
Press.
get married, I don't give two craps anymore because I have you.
Yeah.
So we have to learn how to be a marital partner. That takes work, and you have to adjust to that because now I've moved into your house, or you've moved into mine, or we've moved into a place together. Okay. And some of the things that I do might be annoying to you. So I have to learn to accept or adjust to those patterns and those things that you do. This happens with blended families too, when you bring different people to live into the household, because they have to get used to living with one another. And, you know, sometimes like even, and you guys might feel this in some of your families, if any of you live with your in-laws, okay? Because now you're in the kitchen cooking and mommy-in-law comes in and she has her way of doing it. You want to do it your way to please your husband, but she gonna tell you how to please her son. And she don't want to hear about your way because she has her way set in stone and she's stubborn as a rock. Same thing with the guys, okay? Daddy's going to tell you how he wants you to treat his little princess or what he expects of you. The nurse provides the mother of a toddler with the phone number for Poison Control Center. Which level of Maslow's hierarchy of needs is the nurse addressing?
B.
B as in boy? Are you saying B as in boy or D as in dog?
B as in boy.
Good. All right, safety and security. The nurse is conducting a family assessment of a traditional family. Which assessment data Q describes the social economic status of the family?
B.
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 Yep.
As
B.
in boy?
It's B,
Yes,
yes.
boy.
As in boy.
I think it says, yeah.
Okay, occupations of the parents provide financial support for the family and contribute to the socio-economic status. Affiliation with religious organization is a source of social support during stress, which can promote adaptive coping for the family. Cultural and religious activities of the family define values and beliefs important to the family members. Recreational activities such as vacationing together promote interaction of family members. So, you know, one thing too you want to think about with the affiliations with the religious organizations, they can definitely be a social support, but what else can they do? They can sometimes take people down the wrong path if they get involved with the wrong one, right?
Oh, yes.
And take them towards a thing that might not necessarily be geared towards something that's great for the family. We've seen this in cases like Jim Jones, you know, and other affiliations out there of religious organizations. The nurse is assessing the family structure of a client and determines it's an extended family. Which of the following represent the extended family?
B.
B as in boy, 2 parents, 3 children, 1 grandparent.
Yes.
Good. All right. The blended family would be D. Okay. And then I guess C would just be a regular family. Okay. Primary family or traditional family. And then just different groups of people that live together. They're considered cohabiting. And if you go in front of Judge Judy, you're not going to get squat for it. Okay. Geez, dry morning here. Where's my laughter? That was supposed to be funny. All right. I guess you're on mute. That's
This
it.
rain
You were
got me
laughing, but you
sleepy.
were on mute.
The rain got me sleepy. I'm sorry. I'm here though. I'm listening. Promise.
Okay. The dopamine helps the brain, you know, connect. So I try to make it funny. All right. The nurse is assessing the communication style of the client. Communication is an example of which dimension of the individual?
I think it's D.
D, sociocultural.
I think I agree with that.
Okay. Communication is essential for interaction with others because what happens when people can't communicate? Well, a perfect example of this is, how many of you have ever worked with a patient that's in a coma? Anybody? Anybody ever had a family member that's in a coma?
No.
So, you know, when you're a nurse and you're working on a floor and you have a patient that's in a coma, a common practice that happens is that, you know, 1 or 2 nurses might go into the room together, or a nurse goes into the room together. And what do when they go in that room?
Talk to each other.
Right. And what do they talk about?
Everything.
Like,
Personal things. Everything.
and a lot of times the patient, right?
They could be talking about the patient as well.
Sometimes they'll talk about smells or looks of the patient. Okay. A lot of times they're just focused on the machines when they go in there, and they'll give the meds. They don't talk to the patient at all. They either don't talk when they're in there, or they only talk to each other. And there's no communication with the patient. Now that's different, because if you're going into the hospital and you're visiting your family member that's in a coma, what are you likely to do?
Patient.
You're gonna talk to them.
Talk to
Yeah, you're gonna talk,
Their hand,
right?
mhm.
Because you're trying to wake them up. So you want them to hear you, and you're praying that they're gonna hear you and wake up. But as nurses on the floor, we lose that dimension sometimes. And we don't treat the patient with the same respect and dignity that we should when they're on ventilators and in a coma, because we forget the fact that they could actually hear everything we're saying when we come in that room. But technically, we should be coming into the room, and as soon as we come into the room, we actually should be going right to that patient and letting them know, hey, this is so-and-so, I've just entered the room, and this is what I'm gonna do while I'm in here. How frightening do you think that is for the patient if they're actually laying there and they can hear you, they can't move, they're on this ventilator and stuff, they have no way to communicate with you at all. Their eyes don't move, their hands aren't moving, you know, their brain might be moving, you can't see that part. which is why I always say you got to be the best nurse you can be, okay? Eat it, sleep it, drink it. When you look in the toilet, there better be nursing poop looking back at you. That's when you're ready. Because the worst thing you could do to a patient is make the wrong move, and that patient ends up like that. They're better off dead than being like that because they might never wake up or move again. So you want to know your stuff. Which nursing diagnosis is the priority according to Maslow's hierarchy?
D.
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 So I hear D, I hear B. Okay,
A.
constipation is elimination factor. Is that going to kill somebody?
I'm gonna go
Yeah, it's an
A.
unsolved problem.
I think D. Constipation.
Okay, are you saying constipated because it's an actual problem?
It is.
Now, another thing you want to think about these, and sometimes this is where it gets sticky, okay? You also want to think about safety. Now we're talking about basic needs. So basic needs, is elimination included in the
Security.
basic needs?
It's A.
So it gets to safety, which is A.
A.
I thought elimination was a basic need.
Right. That's what I thought too. Right.
Oh.
It is.
It's
But this
D.
is how I want you to see how it can trick you up. See, D was a real problem, not a potential, and it's a physiological need. It's elimination, right?
And it didn't say that the person in A actually fell. It just said they was at risk
Right.
of
The
falling.
rates of falling.
So it's asking you about the most basic need here. All right, good. You're seeing stuff, okay? You're going to see stuff. And that's hopefully going to help you answer questions better. It's not important that you get it right or wrong here. It's important that you learn how to answer the questions, how to attack the questions, because if you don't attack the question's going to attack you. And carefully reading the questions, because a lot of students make the mistake of looking for the right answer. When you're doing nursing questions, it's not always the right answer. Now, knowledge content, yes. You know, it's the majority of time, it's going to be that right answer. But when you start doing critical thinking questions, it's going to be the best answer because a lot of times more than one answer is going to be right. During the patient assessment, the client shares that the family attends church nearly every Sunday. What function of the family does this represent?
A.
A.
Okay, so socialization is those values and beliefs, including religion. Financial aid to family members is economic. And physical needs are about the safe, comfortable environment that's essential for growth and development. The nurse is implementing care for several clients. Which of the following clients is the nurse helping to reach the highest level of Maslow's hierarchy of basic human needs?
A.
So we're talking about the highest level. Okay, so highest level is what?
Self-actualization.
Self-actualization.
Self-actualization. So what would that incorporate there? A, I heard. Anybody else?
A for sure.
Okay, the nurse who provides privacy for the client and the family during times of prayer is helping the client reach self-actualization, the highest level on the hierarchy. Basic level is physiologic need for physical activity, and that would be the range of motion. Teaching the daughter how to perform the finger stick is meeting physical safety needs. And the nurse facilitates love and belonging with the family visiting. The nurse is conducting a home health assessment and suggests that the client's family remove scatter rugs from the home and increase lighting, which basic human need is being addressed by the nurse's suggestions.
D.
D.
B or
No,
D?
D.
D as in dog?
D is
Dog.
All right, I'm just seeing if you're paying attention. All right. Making changes in the environment, such as removing those throw rugs and increasing the lighting, promotes safety. And that falls under safety and security. That was a butt dial. No, because I'm teaching, it was a butt dial. That's right. Yeah. Great. Right. Yeah, I mean, really the incubation period is 2 to 19 days, but now the CDC cut it down saying like, if you're not 7 days, if you haven't been 7 days, then you're good. Yeah. Yeah, and loss of taste or smell, that kind of stuff. Yeah. Yeah, that's definitely a sign. Yeah. Yeah, I make people come in my house where, yeah, you can still work. And actually, they might give you a rapid test anyway when you go in on Sunday. I would get another one done if they'll give it to me when I go in on Sunday. Just tell them you were exposed. All right. All right. All right. Bye. Sorry. All right. It didn't bring up the book for some reason again. I lost it. Let me go back to it. Where you at, chapter 5? So guys, over the weekend, I'm going to be gone for a couple days. I probably won't be back around till Wednesday. All right. I'm going to send an email out. You guys can reach out to Ms. Zelinsky if you really have an issue with something that you need to be addressed. She could probably help you pretty well. And Ms. McKelvey also, which is the day L to R instructor. Oh, 5, 5, 5. Can count.
I do have another question, Miss Susan.
Yes.
So I received, I'm sure everybody else did, it was an email about like a practice exam.
Yes, for exam soft.
Yes, so the questions are timed.
Yes.
You have a certain amount of time per question.
If you're an exam soft, it's usually a minute to a minute and a half, depending on the exam.
It's 30 minutes, and I think it's like 6 or 8 questions.
Okay.
So you get like 30 minutes to do it.
Okay. I didn't do it yet. I just I saw it yesterday, and I said I wanted to do it because I was looking.
You guys doing it on your own?
Well, it's a practice test. Oh, what, at 3
You're
o'clock?
able to log in and do it on your own. That's great. Everybody should do it.
Well, it gave login information.
Yeah, you know what? I'm going to send an email out, and then I'll just let people know, like, at least for the evening class. If you have any difficulty logging in, just shoot me an email. Because I am going to come on Tuesday evening for the evening class to make sure everybody's logged in and ready to go. And done the practice. That's my intention, unless something changes. All right. When moving to China, a North American college student is experiencing many new feelings that students associate with placement in a different culture. What are the feelings experienced by this student?
A.
Cultural shock, C.
Yeah, so when they feel strange or weird because they're in a new environment, or let's say your patient won't take pain meds because you make them feel like it's something wrong with it, or they'll do this or that because you make them feel like there's something wrong with it. It could be a little bit of cultural shock.
Right.
All right, so the person feels weird because they're not like other people. Now, stereotyping is the assumption that everybody's alike. Ethnocentrism is the belief that your ideas and practices are better and superior than others. So the way I do it is better. And cultural assimilation is when we start to lose our own characteristics and develop those of others. So some of you that came from other countries might see this with the kids, right? Instead of eating your traditional types of foods that you still love to eat, they want to eat McDonald's or fast food, right? They don't want to eat the African food. They could just send it my way. They don't want to eat, whatever, the Asian food. They want to eat the McDonald's and stuff. A client who immigrated from Pakistan informs the nurse of the dietary requests. The nurse responds to the special dietary needs by stating, "You are living here now. You should try to start eating these foods common to our diet." This is an inappropriate response. This inappropriate response is an example of what?
B.
You say B as in boy?
Yeah.
Okay, it's actually D. D.
What?
D.
D.
As in dog.
D is in dog.
Yes. Okay, when you tell somebody you're in Rome, you have to do as the Romans do. That is D. Right? So what you're saying is, nah, you ain't bringing that mess here. You're imposing. You're imposing on me and my culture, okay? You're imposing on me by bringing your ideas to me.
Okay. So
Okay?
can I ask you a question?
Yes.
Can you give me an example of what cultural blindness is?
So cultural blindness is when you don't recognize that there's differences in cultures.
Okay.
And cultural assimilation, again, is when I start to develop things that you do. And this could actually happen, not even like, let's say I'm from the North and I move to the South. Like, eventually I'll start to pick up habits that you have. And then when I come back up North, even though I don't realize I did that, when I come back up North, people be like, "Y'all, where'd you get that from?" Or you start doing little things that are different because you've been around a different culture now, and they start looking at you a little funny, like, "Hey, where'd you learn that habit at? You didn't do that before you left here." And then, of course, diversity is just, that big melting pot that we have in the United States. So again, blindness is ignoring the differences and acting like they don't exist. In this case, the nurse recognized the difference and said, "Oh no, you can't bring that here." Where do you sometimes see this at in America is, you don't see it as much now as what we used to, because now I think people have gotten a lot better. But back in the day, like when you went to church, you had to be dressed up. You didn't walk into church wearing jeans and sneakers and t-shirts. And I know in a lot of churches, people still don't come in that way. But a lot of churches now accept you no matter what. In addressing health promotion for a client who is a member of another culture, the nurse should be guided by which principle?
D.
The client may have a very different understanding of health promotion.
Mm.
That sounds reasonable, because if their idea and my idea is not the same, what's going to happen?
D.
I think it's D.
We have to see eye to eye with the client. That's the best. Okay. And remember, it's ultimately their decision what they want to do. It's not your decision, not what you think's best, not what you would want them to do, not how your friend down the street did it 16 years ago. Right? Because when I make a choice about my health, I'm the one that has to live with that choice. I also know what my lifestyle, my culture, what I'm going to actually realistically do. You can't convince me to do something unless you can show me there's value in it for me. The delivery of culturally competent nursing practice incorporates the concept of what?
D.
D. Planning and implementing care in a way that is sensitive to the needs of individuals, families, and groups from diverse cultural populations. That makes sense. Now, remember, Judge Judy says if it doesn't make sense, it's not true. So challenging the beliefs and values of a client from a diverse culture, would we do that? That would be cultural imposition, right?
Mhm.
If we're saying your ideas don't belong here. Well, I'd be mad as heck if they took some of the different cultures, especially the foods that have been brought to this country from other cultures. I'd be mad if they took that away. Remember, ethnocentrism, that is what?
My culture is better than yours.
Yep. Yep. I'm better than you are. I'm better than you are. I'm ethno. I'm better than you are. Their ethno culture better than mine. Their ethno culture better than mine. I try to do little rhymes because when you get to the test, hopefully you hear the little rhymes in your mind.
Helpful.
You
Thank you.
can't hear me, but I'm cracking up.
I know. Me too. Me too. I'm sitting here cracking up. But that's helpful.
Okay, good. Recognizing that the healthcare system is void of culture and that cultural imposition must occur. Well, that's true according to the Trumpster, right?
Mhm.
All right, so D makes sense. All right, so culturally competent care means that the care is planned and implemented in a way that's sensitive or individualized to the person, their family, and their group. And sometimes we have to individualize to the family, because if I'm of a certain culture, all right, the husband's going to make the decision, or if I'm another culture, the wife's going to make the decision. We know realistically in all cultures that women make the decisions. We just let the men think that they're making them. You can stand up and defend yourself anytime you want, guys. All right.
They know it's true.
A nurse who provides care in a large inner city hospital is aware of the large influence of culture on health. The nurse recognizes that culture is best understood as a shared system that encompasses what?
A.
A.
Sure. The things that I value, the things that I believe in, and the things that I practice. because I don't really practice something I don't believe in, right? I'm not going to do something if I don't believe in it. Like if I'm a Jehovah's Witness, I'm not going to practice getting blood transfusions. Even if I don't believe in inoculations, I'm not even going to practice getting a flu shot. And if that flu shot has no value to me, if I feel like that flu shot's going to do me more harm than good, then I don't value it. So I'm not going to be compliant with that. And that also falls into the beliefs. So how we think, how we behave, how we dress, how we eat. All right. These are all things that are values, expectations. They directly affect things about our life. Which statement best conveys the relationship between race and ethnicity? So are they synonymous?
No.
Okay.
D.
D.
I think it's
I think it's D.
D.
I think it's D too.
D as in dog,
in
one
dog.
denotes
D as in
physical
dog.
characteristics, while the other is rooted in common heritage.
Yes.
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 Because within one culture, there can be different ethnic groups, right?
And they could be different colors.
Mm-hmm.
Okay. Well, you could have two people in the same family. You could have a set of twins that come out of one mom that could be different colors. Right? Have you seen it? I've physically seen it. Where one twin is born white and one twin is born black when they have a white mother and a black father, or vice versa. So which one do you like?
D.
D.
Okay. Race denotes physical characters, while ethnicity is about heritage. So if you think about different ethnic groups within a culture, and race, I gotta have big feet to race. That's a physical characteristic. I need big feet to race, right? Long legs to race, so I can be a fast runner. Right? Ethnic is going to be about my cooking. Like I'm Spanish, so I use those ethnic ingredients when I cook. You know, it's about the things that my grandparents and my ancestors taught me. An older client who only speaks Cantonese has been admitted to the emergency department after suffering a fall and a suspected hip fracture in the home. Who is the best person to perform translation services to the client?
I think it's D.
D.
B. Oh,
B. B
D.
as in boy.
Is in
A
boy.
hospital
Okay,
translator.
a translator. And when are we going to get that translator?
When?
When?
As soon as possible.
Yes, as soon as we approach that patient and we find out we can't communicate. Why don't we use D?
Because the family member can translate the words into whatever they want them to be.
Or
Or they don't
confidentiality.
speak English either.
So
Or
yes, all three of those
confidentiality.
reasons, all three of those. And it's not really so much that the family member like is conscientiously not saying what the physician or the nurse is saying to the person, but the way they interpret it.
Interpret. Mm-hmm.
And especially if they don't really understand, like they might speak English. That doesn't mean that they understand the medical jargon, and it doesn't mean that they really understand the English. Because sometimes even when you speak another language and that's your primary language, even though you can speak English, it doesn't mean that you understand and comprehend every term in the English language, and vice versa if someone were speaking another language. So, you know, sometimes people try to say something in another language and it doesn't come out quite right because they don't really understand how those words are used when they're put together in a phrase. A trusted friend would be a HIPAA violation unless they gave permission or consent. And again, it would be the same issue as with the family member. They may not interpret the information the way it was meant to be interpreted. And a hospital employee could be a HIPAA violation, 1, and 2. It doesn't necessarily mean that they would be able to translate, because if they work in the cafeteria or something, they might not understand medical jargon and other things either. A client's husband is asked that his wife be cared for exclusively by female nurses. Knowing that this couple is originally from the Middle East, which action would the care take in response to the request?
B.
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 As
So,
in boy.
yeah, you're
B.
gonna do whatever you can to accommodate it. Can we always accommodate this request?
Not always.
No,
No, you can't.
Not always.
we can't always accommodate it. Because let's say in the COVID situation, right? We have limited staffing sometimes. But as the nursing supervisor or the charge nurse on the floor, if I can do this, as a matter of fact, for the most part, I'm going to try to accommodate any request my patient has that's reasonable as the charge nurse, right? Because I want their stay to be a pleasant one. That's going to make them heal faster. It's going to make them, you know, they might already have a miserable life at home. They don't need you to help them with that. Some nurses really get annoyed and nasty with patients when they talk to them. Like, what do you want? I'm doing you a favor being here. Like, really? Really? You're doing me a favor? Because if I wasn't sick, you wouldn't be getting paid 45 bucks an hour to be taking care of me right now. And if everybody was healthy, we wouldn't need you. So it's really a dual thing there. You need the patient as much as they need you. Be nice to them because you don't know what's going on in their life. It's like they don't know what's going on in yours. Sometimes you can make a difference in somebody's life. Just like if you walk into a restaurant and the waitress comes up to the table and she's a little mean. At the end of the day, tip her an extra $5. What's it going to cost you? But you know what? You might make a difference in her day because maybe somebody before you was a real, you know what? And it doesn't matter that it wasn't you and that she brought it towards you. Maybe everything else that's going on in her life right now was just too much at that moment. And sometimes we just can't deal with it when we get back to back to back to back stress. And that's what's happening when your patient is hospitalized, right? They're going to be stressed. So any way you can reduce that stress is going to help them to heal. How is culture learned by each new generation?
D.
D.
I'm thinking D too.
D.
So I feel like B is more encompassing than B is. I do believe that B plays a part of it, but I don't believe that B plays the only part of it. So it's a system of beliefs, values, behavioral expectations that provides social structure for daily living. It includes beliefs, habits, dislikes, customs, and rituals learned through both formal and informal experiences within your family and your cultural group. The nurse is assigned the care of a client who speaks only Arabic. The nurse does not know the language. Which action is appropriate for the nurse in this case?
A.
B.
B.
D.
B.
Good.
The
Get that
song.
interpreter.
Some B.
Get that interpreter. A client who only speaks Japanese is admitted, reporting chest pain. Since the assigned nurse does not know the client's language, what would be the most appropriate solution?
D.
D.
Yes, I like this question.
Really stress the interpreter.
Right?
Well, because a lot of times people will still pick the family member and all. Okay.
Same thing for a deaf person. You should always get an interpreter right away.
Well, because if you don't speak fluent sign language, okay. Now, it's also for a deaf person, you can give them a piece of paper and a pencil. All right. You give them something to write with because they might be able to write even if they can't talk. Still going to look for that interpreter, but you can at least help them at the moment to try to determine a couple of things. And a client of Arab descent is admitted to the healthcare facility with varicose veins. What should the nurse avoid while conducting the interview of the client?
Is it A?
A.
Avoid eye contact.
Wait, did I read that wrong? Oh, yeah.
Oh, maintain eye contact. I'm sorry, but it's asking what you would avoid doing.
Right.
So the handshake, women cannot shake the hand of Jewish men. It's offensive in case you don't know that. A client with Asian heritage is admitted to the healthcare facility with hypoglycemia. After the client is stable, the nurse discovers that the client has not had the prescribed medicines. The client believes that eating saffron will keep his blood sugar under control. What is the most appropriate response by the nurse?
B.
B as in dog?
B as in boy.
All right, well, B as in boy, I think is wrong because it's a
D.
why question and that's defensive, so we don't
D.
generally ask why questions. A, if he believes that the saffron is going to help him, I'm not sure that A is going to be an effective statement, but it might be.
I think it's D.
D.
I feel like D is a little
D.
confrontational. But let's see. D as in dog, you guys want? Let's see if it's going to look
Yes.
Yeah.
Was B.
Wow.
And I talked you guys out of it.
I mean,
Well, I'm going to tell you most of the time, I could say about 98% of the time, we don't use why because it puts the patient on defense and it's not therapeutic, okay? And you'll see that in any therapeutic communication as you go along. So we'll take it for today, but typically you're not going to ask a why statement. All right, the nurse is caring for a post-op client of Asian descent after knee arthroplasty. The nurse plans to help the client ambulate, but is aware that the client may feel threatened due to physical closeness. What would be the most appropriate nursing action?
Let the client.
A.
B as in boy.
C as a cat.
D.
All right, so which ones can you toss?
Well, you don't want to let him just go on his own.
You don't
Easy
want
to
to,
fall.
right, you don't want to, right, you don't want to B. You don't want B.
I'll go
C.
C. C, yeah, I agree with C. I think it's
C.
C. I think it's C.
Okay, good. Explain the purpose.
You need to explain to the patient why it's important for them to perform that function.
So you're not going to ignore them because that's not therapeutic, all right? You need to give them an explanation. That might help relieve their anxiety. All right, let's try number 6. All right, parent of a high school student age 17 allows the child to make the decision that college will be attended. When the child requests direction from the parent in making this decision, the parent responds by stating, "You will need to make this decision on your own." Which type of value transmission is the parent displaying?
A.
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 Wanna say
A.
parent?
A.
I think it's A. Yeah.
Well, isn't laissez-faire like whatever you want? But in an
Whatever you want,
irresponsible.
no guidance. Okay.
Easy.
In delivery of care, the nurse acts in accordance with nursing standards and codes of ethics and reports a medication error that she has made. The nurse is most clearly demonstrating which professional value?
B.
B. Integrity.
Is in boy.
Integrity. Okay. Good. So altruism is a concern for the welfare and being of others. All is true that I care about you. All is true that I care about you. Altruism. Social justice is upholding moral legal values and humanistic principles. So they're doing things that will help everybody, not just one person or another. Human dignity is respect and inherent worth and for the uniqueness of individuals and populations. An employee health nurse is assisting a stressed working mother with value clarification. Which of the following best defines value clarification?
B.
C, as in Charlie, you're saying?
I think it's C too. C is in Charlie.
C.
Okay, a process by which people come to understand their own values. Client rings the call bell to request pain medication. When performing the pain assessment, the nurse informs the client she will return with the pain medication. The nurse is promised to return with the pain medication is an example of which principle of bioethics?
Fidelity. B.
Is in boy.
Fidelity.
Yes.
Okay, keeping a promise. Okay, so fidelity. When you get married, you keep a promise, right? Fidelity. When you're not, when you're infidelity, that means you didn't keep that promise. So try to remember that part. Autonomy is respecting the rights of clients or their surrogate to make a decision. So you're allowing them to make their own decision. That's autonomy. Maleficence is preventing harm from being done to the client. So you're like protecting them. All right. And justice is giving the client their due and act fairly towards them. Give them what they're due and act fairly towards them. Nurse working on a critical care unit was informed by a client with multiple sclerosis that she did not wish to be resuscitated in the event of cardiac arrest. The client is no longer able to express her wishes, and the family has informed the physician that they want the client to be resuscitated. Aware of the client's wishes, the nurse is involved in a situation that may involve what?
D.
D as in dog?
Yes.
Yes.
Okay.
Ethical. Yes.
Because deception, that would be about lying. Paternalism would be about who's the parent. Confidentiality is violating the HIPAA.
Yeah. So yeah.
Okay, the nurse would want to represent the clients, or might, if the nurse believed that it was better for the family to resuscitate, then they might not say something. But you should always honor the wish of the client. Using the nursing process to make ethical decisions involves several steps. Which step is the nurse implementing when she reflects on the decision-making process and the role it will play in future decisions?
Evaluating.
Planning. Planning.
Wait.
E.
So how will the decision-making affect my future? Or my patient's future, really?
E.
All right, planning includes identifying options, exploring short-term and long-term consequences. The nurse has completed 4 hours of the 8-hour shift on a med-surg unit when he receives a phone call from the nursing supervisor. The supervisor informs him that he needs to give a report to 2 other nurses on the med-surg unit and immediately go to the tele-unit to assist with staff needs on that unit. The nurse informs the supervisor he's been busy with client assignments and feels this will overwhelm the nurses on the med-surg unit. The supervisor informs the nurse that the need is greater on the tele unit. This is an example of which type of ethical problem?
A.
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 Okay, good. Allocation of scarce nursing resources. So as the charge nurse or the RN on the floor, you have to be able to look at your situations out there and determine if this happens or that happens, what are the steps that I'm going to have to take? Because, you know, I've walked into a facility when I've been the only RN on grounds because people called out. So now you usually work with 23 nurses and today you got 12. How are you going to allocate those resources? How are your employees going to feel about it when you do it? Because some of them are going to have something to say about it, right? Because what are you going to have to do? You have to give them extra workload, right?
Extra work.
You got 12 people and 23 people usually do the work. That means you're going to have to double the work up on all of those people.
But I'm gonna have to call you later. I'm in class right now, okay? Okay?
So how are you going to do that? And so, you know, when I walk into a shift, the first thing I do is look at my staffing. And when I look at my staffing, I know right away if I have adequate staffing if a code goes off. Because that's what I'm thinking about, right? What happens if a code goes off? Will I be able to help that person? So I look at my staffing and I say to myself, how many people do I really need to cover here, there, or the others? Now, when you walk in and you don't have any call outs and your staffing's beautiful, you don't have to really do this. But how often does that happen? And in this situation, it's more not than it is, right? It's more often that you're walking into a situation that's understaffed than one that's overstaffed or equally staffed. So now what I do is I call my Girl Scout mode. I'm going to develop a team plan right then. I'm going to tell my people that come to the nurses station, hey, here's the deal. If this happens, you do this. If this happens, you guys do this, and you guys do this. So now we have an action plan. So if something goes down, we're covered. We have what we call a code team in place now. And you know what? It's a blessing because usually when you have that code team in place, everything goes smoothly. But what if you come in the morning and you just throw people in different places? You don't give it any thought, okay? And then you go in your office. I got everything covered. I'm going in my office. It's short. I'm not dealing with this. This is what they do, right? I know you see your RNs doing it.
Yes. Oh, yes.
I'm not going out there today because I might actually have to get my hands dirty. Okay? Not the kind of nurse you want to be. You need to know what's going on with your patients. When you do things like that, number one, you promote such a positive atmosphere among your staff. Number one, you're saying to you, hey, you're important to me today. I need you to be part of my team. If something goes down, we're going to do this together. I'm going to do this part. You're going to do that part. And two, it's Murphy's Law. If I go in the morning and I don't check my emergency card, or I don't do something I'm supposed to do that I normally do as part of my organization when I go in the morning, what happens?
Liable.
It just becomes unwrapped that whole morning, right? It just becomes a nightmare. It's like there was a full moon last night and it caught me today. Because when you're not prepared, like whatchamacallit says, Forrest Gump, shit happens. Excuse my French. Which action most clearly demonstrates the nurse's commitment to social justice?
A.
Okay, social justice is a professional value that encompasses the efforts to promote universal access to healthcare. All right. So we're trying to make sure everybody gets an equal piece of the pie. Everybody gets the same access to the same physicians, to the same level of healthcare. When you think about social justice, think about the social injustice that used to be in healthcare. Okay. A lot of people died with simple problems because they couldn't go to a particular hospital. All right. Or because people wouldn't treat them because they weren't a certain person or a certain type of person. It's come a long way, but it still has a long way to go. A long way. So as the nurse, you have to fight for social justice for your patients who are met with those inequities. Because the only way we're really going to make all of America healthy is to make everybody healthy. A nurse is providing care for 3 clients on a medical unit. 2 are significantly more acute than the third. The nurse is making a concerted effort to ensure that the less acute client still receives a reasonable amount of time, attention, and care during the course of the shift. The nurse is, which of the following is the nurse attempting to enact? Come on, guesses, guys. Take a guess. Be
Is
wrong
it
now.
B? Is it B? B? What?
C.
Well, she's trying to demonstrate equally and fairly distribute her time, right? So
Oh,
that's
sorry.
what makes it
Gotcha.
justice.
Gotcha.
But she's trying to equally distribute. Which statement best conveys the concept of ethical agency? Any guesses, guys?
I think C. I think C.
Let's see.
C is in Charlie.
Anybody else?
B?
B.
So, you know, we have to culture and believe that that ethic is the right thing to do. Because that drives us to do it all the time. When we break sterile field or when we do something we're not supposed to, it drives us to go back and do it the right way.
You know the thing that.
All right, we're going to do one more from here and then I'll go to chapter 7 so we can do a few from there. A client tells the nurse he does not want to have a painful procedure. By respecting and supporting the client's right to make decision, what is the nurse demonstrating?
A.
A, advocacy. Is that what you
Yes.
said?
Yes.
Yes.
Okay, good. All right, so you definitely want to go through these, okay, and know the different ones. Let's see. Veracity is truth telling. Let's go to 7 for a little bit before I got to jump off of here. Okay, what process evaluates and recognizes educational programs as having met certain standards?
A.
Which one? Come on.
D.
D, credentialing.
Accreditation.
It's
C.
C.
Accreditation.
C.
Is it C?
C.
Yeah, accreditation. This is why you have to meet certain standards when you're in the school, when you're doing the online, because if we don't meet Department of Education standards. We don't meet the criteria required by our accreditation department or by the people that are backing us, our accreditors, as we would say.
This is
Okay, so registered nurse has had her license suspended after being convicted of being impaired at work. What governing body has the authority to revoke or suspend a nurse's license?
A.
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 Why did you say state board?
Okay, the State Board of Nurse Examiners in the United States may revoke or suspend a nurse's license. A nurse exits the room of a confused client without raising the side rails on the bed. The failure to raise the side rails would constitute the element of liability related to malpractice. Would constitute which element of liability related to malpractice?
Is it A?
A.
A?
Maybe A.
Okay, a breach of duty. That's when we fail to meet the standard of care. Let me just tell you the other ones. Causation is failure to use appropriate safety measures and it causes injury to the client. Okay. So maybe water was on the floor, you spilled something on the floor, you didn't block it off or have somebody clean it up and they slipped and fell. Duty refers to an obligation to use due care and is defined by a standard of appropriate care for the nurse-client relationship. Damage refers to actual harm or injury that the client incurs. Injuries related to lifting or transferring patients occur in a healthcare setting and may be considered a work-related injury, which law is intended to reduce work-related injuries and illnesses.
OSHA.
Yeah, B.
OSHA. OSHA is all about me, the employee. OSHA is all about me, the employee. Nurses are occasionally asked to witness a testator's person who makes the will signing of his or her will. Which of the following guidelines is true regarding a nurse's role in witnessing a testator's signature?
D?
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 So a beneficiary to a will is allowed to act as a witness. A single witness is sufficient for
No.
a will. Witnesses do not need to observe the signing of the will and can sign it at a later time. Witnesses to a signature do not need to read the will.
D.
Is D.
Good. During the admission assessment of a female client age 40 with a suspected mandibular fracture, the client discloses to the nurse that her injury came as a result of her husband hitting her. Which action should the nurse prioritize when responding to this disclosure?
A.
A.
Okay, good. Reporting the abuse to the authorities. At the reporting to work for the night shift, the nurse learns that the unit will be understaffed because 2 RNs called out sick. As a result, each nurse on the unit will need to provide care for an additional 4 acute clients. In addition to her regular client assignment, which statement is true for this nurse when working in understaffed circumstances?
D.
Yeah, I agree. It's D too.
D?
I think it's D. D is in dog.
Yeah.
Okay, good. The client states his recent fall was caused by the fact that his scheduled antihypertensive medications were mistakenly administered by 2 different nurses. An event that is disputed by both of the nurses identified by the client. Which measures should the nurses prioritize when anticipating that legal action may follow?
D.
Mercury.
C.
I think it's D. I think it's D.
D.
D, you're saying as in dog?
Yes, D is
Yeah,
in
D
dog.
is in dog.
Okay, document the client's claims and events surrounding the alleged incident. Always clearly and accurately document, okay? Because a lot of times when you're involved in a lawsuit, excuse me 1 second. Hello. Hello. When you've taken care of 10,000 patients 5 years later, you're not going to remember what happened. Okay, so you always want to write in a manner that gives you a clear-cut picture of what you did, what happened, and in legible ink. Did you ever write something and you go back like, you know, the next day because you forgot to add something on it? You're like, what in the world did I write here? You really can't read it. Did that ever happen to you? It happens to me sometimes because I'm a sloppy writer. All right. If you went to Catholic school, it probably doesn't happen to you, but I didn't. So, you know, I write sloppy and then I can't read it. And it might not be the next day. It could even be a couple weeks later. So 10 years or 5 years from now, you're not going to be able to read it. And this is a lot of times when somebody takes legal action against you, it's going to be a couple years down the road before that lawsuit comes about. And you're going to see a million patients. So unless it's something really, really so rare happened, you're not going to remember it. So you want to have that clear-cut documentation to support and to save your butt, cover your booty, as we call it in nursing. It's not what happened, it's what you can prove. If the documentation is sloppy, they can prove a whole lot. Which situation is an example of battery that the nurse may experience while performing her duties at a healthcare facility? Battery.
Is it C?
C.
C.
The C?
A.
C, okay. When you touch the client, okay, it's battery. You've touched him in this case, right? Because you did a surgical procedure. All right, so battery is when you touch him. And assault, okay, remember, with assault, I'm about to whoop somebody's ass. So you're threatening to whoop them, but you're not actually touching them in assault. You're threatening them. In battery, you're actually touching. Two nurses meet at their home where one of the nurses discusses a client who has been physically abused. The next day, the client is shifted to another nursing unit after a surgical procedure and becomes the care of the second nurse, who had been part of the original discussion. Nurse number 2 asks the client about the abuse. The client discovers that his original nurse revealed the information and is hurt. What would the charges be if the client follows suit?
D.
I'm gonna go with D.
D?
Yeah, both info.
Okay, so the difference between libel and slander, okay, slander is if we talk about it, libel is if we write it, okay? So I wrote it on the libel. Now stick it on the jar, I wrote it on the libel. All right, slander is when we just talk about it. All right, you're a no good, dirty, low down, stinking man. A client is unhappy with the health care provider to him. He approaches the nurse and informs her he's leaving the facility. The client has not been discharged by the physician. The nurse finds that the client has dressed and is ready to go. What would the nurse's action be in this situation? All right, how about 1? Can we do that?
No.
When can we do 1?
I'll say D, call the supervisor.
When can we do 1?
When can we do one? What did you say?
Can't restrain.
Can't.
You can. I mean, your book will tell you that you have to get a physician's order, but if a client is trying to harm himself or others, you can legally restrain them. I guarantee you, if a client tries to kill himself and you don't stop him, you're going to be charged with something.
So you have to get a physician's order.
Well, where I work at, you can get the restraint first and do the order later. But textbook says you got to get the order first. But real life, if somebody's trying to harm themselves or others, no time to get an order.
Right.
It's about to go down. I mean, I was in this situation yesterday. It's going down. There's no time to get an order. You got to protect everybody else in the room. You should warn the client that he can't come to the hospital again. Is that true? If I check myself out against medical advice, can I come to the hospital again?
Yes.
Yes.
Because if I'm not stable, the hospital has an obligation to treat me, stabilize me. Then they can transfer me somewhere else. My insurance might not pay for it if I discharge myself against medical advice. That'd probably be the only real consequence. And even then, sometimes the insurance companies give, the patient determines later they want to be compliant and it gets worked out. Really, you can't do anything about it. And you might want to let the nursing supervisor know, though, because they might be able to go and talk to the client and maybe change their mind. We don't persuade, but sometimes we can help the client see value in a different decision. And it's the art of not persuading and letting them see the value in that decision and, being able to get them to make that change of mind like that. But let's see what D says. All right, the other thing is they have to sign a medical release form saying that, you're not responsible if they leave because they're going against medical advice. The client is brought to the ER in an unconscious state with a head injury. The client requires surgery to remove a blood clot. What would be the appropriate nursing intervention in keeping with the policy of informed consent prior to a surgical procedure?
See?
I'll say go D.
Well, you can't do D. Why?
In a coma.
Or isn't it?
He's unconscious. And 1, and 2, he would have to be of good sound mind and body in order to do D. If he has a head injury, you have to determine at that point if he was conscious, if he's okay, or if he's neurologically impaired to the point where he still wouldn't be able to sign for consent, even if he was conscious. So you have to make that determination. And that's why we do neurological checks on these patients, because by doing the neurological check, we can establish some sort of baseline, right, with this patient to determine whether or not we should be talking directly to them or to someone else. All right, we're going to do 2 more.
Ms. Sue?
Yes.
I came across a very similar question to the one that we just did, and the answer was to have the physician sign the consent form.
So we can sign a consent form. Usually it'll be 2 physicians, but we have to first, like if in this case, it's probably a life-threatening emergency because the patient has a clot. So if there were no family members around to sign the consent form, or let's say the family member was an hour away and, the patient's bleeding.
Right.
I can't wait for the family to get here because the patient's going to die. I need to get them in surgery now. In that
Right.
case, I can have two physicians make that decision and sign the consent.
Okay.
But if I had somebody there that knows the patient's wish, that has the legal authority to sign, that would be a proper decision over the two physicians.
Okay.
An HIV positive client discovers that his name is published in a research report on HIV care prepared by his nurse. He is hurt and files a lawsuit against her. Which offense has the nurse committed?
I said C, invasion of privacy. Is it C?
Well, it is invasion. It's not really I'm not sure that it's invasion of privacy.
A.
It'd be more of a HIPAA, but I'm thinking it's B. For some reason. I'm not sure that it would be defamation, because for it to be defamation, I would have to say, oh, she killed that guy, like the Carol Baskin thing, right? You guys know that? You guys know that story?
Tiger King.
He's accusing her of killing the husband. He has no proof that she murdered her husband. He might have a lot of what we call circumstantial evidence. That doesn't prove anything in a court of law. Okay, circumstantial evidence doesn't get you murder charges. If it did, she'd already be in jail. You have to have hardcore evidence. So defamation would be like if I said something like that about you, I could actually, you could actually sue me if it's not true, or if you can't prove it to be true. I feel like invasion of privacy would be going into your records without your knowledge. And I feel like in this, like he gave permission for her to do the research report, but not to use the name.
Right.
But let's see what it says. I'm thinking it's B for some reason.
C.
Oh, you're right. See? I'm a real school nurse, so, a lot of times these textbook questions, I don't always get them. The nurse has committed to the tort of invasion of privacy. Personal names and identities are concealed. Defamation is an act in which untrue information and is not applicable here. Negligence is harm that results because a person did not act reasonably. So, tort of invasion of privacy. All right, well, you'll remember that one since I got it wrong. All right, last one, guys. A client informs the nurse that he wants to discontinue his treatment and go home. Later, the nurse finds the client dressed to leave. Which action should the nurse take?
B.
B.
All right, so everybody on here remembers how I showed you guys to use these questions with your book? To go back and forth, boo of you to keep going through these questions, keep going through them. When you don't know content, or if you're getting answers wrong, like the one I just got wrong, try to look up some topic that's in that statement or that question, okay? And go back to the book and review it, reread it. Don't forget to review the notes that you did take from the books. Because a lot of times students will take notes when they read the chapters, but then before the exam, they don't go back and review those notes. So make sure you go back and review your notes, practice with questions, do your studying in short blocks, spend some part of your day with the kids or the family to make them feel special, and so that you get a little break from the studying. Because when you study in short breaks, your brain is going to absorb it better.
How do I get to these questions?
Okay, so to get to these questions, you go into your book. First of all, did you scratch off the code in the front of your textbook?
Not yet.
Okay, so let's do that. Scratch off the code in the front of your textbook. And then
Yeah.
go into the point. And when you go into the point, it's add a new title. You see my screen?
Yes, I see your screen.
So add a new title. And then when you hit that add a new title, you're going to put that code in that you scratched off.
Okay.
And then you hit next, okay? Now that will load this book onto your computer.
Oh, I think I have this book already. Is this yeah, I have the book.
Wait a minute, because there's two different books. Did you do the scratch off code like I told you? Because if you didn't scratch it off and put the code in, then you don't have it.
I got it from the email from Mr. McCarry.
Okay, that's a different book.
Oh, okay.
It's the same book, but it's a different version.
Okay.
If you want to
So
get
it's
to the
not. So it's not
questions-
like prep you.
If you want to get to the questions, you have to do the steps I'm telling you to take.
Okay.
Do you have your code scratched off?
Yes.
Okay, so go in there and add a new title. And then when you pop up, it's going to look like this.
So it's not like prep
Like this
you.
purple one here. No, this isn't prep you.
Okay.
You'll get this purple book on your screen. So you'll have actually two fundamental books on your screen. Once you load the one with the scratch off code, you'll have this one, and then you'll have the one that has your prep you in it. And then you have to go under student resources. In that purple book. All right, and then Nclex style questions.
Okay.
And Miss Susan, real quick, how do you get back to the dosage calc? I couldn't figure out. I know you showed us how to actually do it to get to the practice questions.
So
but I don't remember.
dosage calcs are right here too, see?
Okay, so it's on. Okay, got you. Thank you.
That's the easiest way.
Thank you.
There's also practice and learn activities, videos here, all types of stuff. New
Oh, wow.
Picmonics.
Awesome. Oh, thank you so much.
Now, here's a little trick. So I always open two tabs, okay? What do I mean by that? So here's my point opened here, right?
Mhm.
See, it's open and I have my content. Now, once I open up my content, I go to this part of the book where your prep view is. Sorry, I got a lot more books than you guys. All right, you see, this is your book that you're using for prep view, right? It looks different. You see it looks different?
Mm-hmm.
You go to course content.
We supposed to have this book or it's on the computer?
This is all on the computer, but you should also have a hard copy of the book.
I don't think I got it.
We don't have a hard copy of the prep you book.
We don't have a hard copy of the prep book.
It's
no,
the
we just have
Taylor's
the
Fundamental of Nursing book.
Oh yeah, we have that. That's when you put the code in. You just put the code in, right?
Right, but you also got an electronic access code to put a book on your computer that you're doing your prep you in.
Is that the small, the thin book that goes with the big hard copy book? I think I didn't put that.
The questions book, the class book.
I'm thinking
like
that's what
workbook.
you're talking about. Yeah, the workbook.
Guys, you're confused.
Mhm.
Okay, you have a hard book that you got when you went to the school.
Right.
When you put that scratch off code in, okay, this is what you get on your screen. That's
I gotta see if mine.
book.
Mine look like that.
J6.
Come on.
Okay, I see.
Okay, when you put that scratch off code in, you should have got this book on your screen, on your computer screen, the purple one. Now, when you put the code in from your email, you should have got this book. So you should have two books on your screen.
Right.
Both
right.
of them say Fundamentals of Nursing. What is this thing doing? Where the hell did I go? See?
Okay. Mm-hmm.
So you should have two books, the purple one and the white one.
Okay.
Now, the white one is where you go to do your prep view. But also in the white one, if you go under course content, and this is what I'm trying to show you. You have an ebook here, okay? When you open up your ebook, let's say you're doing questions from chapter 7. So open up your ebook, okay, chapter 7. You want to register these books on here anyway, because then you'll have them for life.
And then can we do the same thing for our patho book?
Have to look at your patho book. You should be able to access your patho book on,
yes,
on ebooks, though. Yes, you can on ebook. Yes, I'm sorry, you
Okay,
can.
thank
Yes.
you.
All right, so now this is my book, right? So let's say I was doing something in chapter 7. Let's say I wanted to know about battery. So I was doing chapter 7 questions and it asked me something about battery and I didn't know the difference. Look at that. There's the difference right there. Pull it up. Or maybe that doesn't give me the right answer. So I go down a little bit until I find the one that fits that I'm looking for, right? But I'm looking at that straight knowledge. I can go right to it. Now in the second tab, see up here, I have my Nclex style questions. So I'm doing a question on chapter 7. So in order to do this, you have to open up 2 tabs at the top of the screen. One for that purple book and go into the Nclex questions. And then in the other tab, you have the actual textbook open. You can go back and forth and review this stuff. And I mean, it's such a great tool here. And I do believe you can do this with your patho book.
Okay, that's perfect. That's awesome.
Okay. And then if you don't know something, then write it down, make a flashcard. You can even make the flashcards in here. I believe this one has the flashcard feature, although I don't see it. Maybe because it's zoomed out. So there's the flashcard feature there. If I were to make questions, and I actually did make a couple in here just to show you guys, but like I made the flashcard set here, so if you click on it up here, I think it is, it'll bring it up in the book so that you can go through them. And if you don't know them, you can say, I don't know it. So it'll bring the topics back for you to study them. You can make these flashcards just by cutting and pasting from the book. You put the topics in there that you don't really know or you're not sure of and go through them. Like, you know, what don't I know? What do I really need to learn? Okay? All right, anybody have questions?
No.
Thank you so much.
You're welcome. All right, I'm gonna end the session because I gotta get out of here.
Thank you.
Okay, so when is the next session? Is it gonna be Friday?
Next week, I'm probably gonna have the session on Sunday.
Okay, but you're gonna send an
And then
email
after
out,
that,
right?
it should be back into Saturdays.
Can you
All right?
send a
Okay.
heads up email like Friday?
Yeah, I'll try to send a heads up email on Friday. Hopefully I'll remember because I'm gonna be in a different mode, but hopefully I'll
Don't worry
remember.
about it. I'll email you.
Okay, perfect.
Okay. Have a good one. Thank you.
Thanks.
Bye-bye.
Thank you.
You're welcome. Have a good day.